Hello, good morning, Dr. Chua. So for station 1, the first question is to demonstrate how to perform subjective pain assessment to patient. So when the patient comes in, I will ask the following questions. Okay, can you tell me what is your main problem of coming to physiotherapy? Where is the pain? Okay, is it at the neck, the shoulder, or the arms, or all together? Alright, given with this rating scale, a numeric rating scale from 0 to 10, 0 would be no pain at all, 10 would be the worst pain you can ever imagine. So can you rate where is your pain? Okay, so and then from there, ask what types of pain are you feeling right now? Is it dull ache pain? Is it tingling or sharp pain, stabbing pain, or feeling any numbness or tingling sensation throughout the arms? Okay, can you locate where is the pain on your body? Is it at the neck, shoulder, or the arm? Can you locate the pain? And then can you tell me what type of activity that aggravates the pain, and what is the activity that can ease the pain? Okay, aggravate pain, for example, when you're playing sports or when you are working in your computer. And the ease activity could be that you are resting or lying down, or putting some or taking in some medication. And then can you tell me if there is any pain in the morning, during the day, and at night? Does the pain bothers you in sleep? And then I will ask if the pain is really irritable for you, and if it is irritable, can you tell me how much irritability it is, the duration? Is it low or moderate, or it is a very high irritability? And then does the pain really severe that until you cannot do any other activities, or you can still manage? That means the pain is non-severe. Alright, and then for subjective pain assessment as well, I will include a DN4 question, which is a Dolio neuropathic 4 question. So why I choose this question is because patient is complaining and experiencing a chronic neck and shoulder pain, and then there is a symptom of radiculopathy pain. So this DN4 questionnaire consisting of 10 items, 7 items related to pain quality. It has such as the sensory and pain descriptors, and then it has 3 items based on a clinical examination. Okay, and then it is a questionnaire that is very useful for neuropathic pain. Okay, so the questions for DN4 are we'll start with question 1. Does your pain present one or more of the following characteristic? So a patient have the option: pain feels like burning, painful cold, or pain feels like electric shock. For question 2, in the same area of the pain, is the pain associated to one or more symptoms like tingling, pins and needles, numbness, and itching? And then for patient examination, question 3, is the pain located in an area where the exam unveils? If there is any hypothesia to touch and hypothesia to pinprick. And question 4, is the pain provoked or increased by brushing? If yes, it's a 1 point, no 0 point. And then the patient's total score will be calculated. And then if it is 4 and above out of 10, it indicates a neuropathic pain. That is for subjective. And for objective pain assessment, so for objective pain assessment, I will start with a general observation. First observe the posture of the patient. Start from the front view observation. Observe from their ear level, with either it is symmetry, and then the shoulder level, if it is one side up or one side down. And then also nipple line is not visible, so cannot observe. Also from the front view, you can observe the gap between the body and the arms. Okay, one side is increased in gap, or one side is decreased. And then from the side view, observe especially the position of the neck, whether it is a stoop position or stoop or forward position, or in line with the body. And then from the back view, observe the same as the front view, with the additional observation on the scapular region. Observe if the scapula are forward rotated, or if there is lateral rotated, and so on. General observation. And then from there, do a palpation on where the patient is feeling the pain. So palpation palpate on the muscles that are major muscles like the sternocleidomastoid muscles, scalene muscles, and upper traps muscles as well. So during palpation, observe for any tenderness, any warmness, swelling, and spasm as well. Okay, and then after that, do a range of motion test for the neck. Alright, so neck flexion and extension range, side flexion left and right, compare, and then rotation as well, compare left and right. So during the ROM test, can also observe the end feel, whether it is soft end feel, hard end feel, and also observe during the range if there is any pain at certain age. Okay, and then after that, test for the muscle strength test. Muscle strength test, same position for forward flexion and extension, side right and legs, right and left neck flexion, and the left and right rotation. And then and then after the muscle test, check for special test for the neck since patient is experiencing numbness. So check for first Sperling test. So Sperling is a test to test for any compression in the nerve between the cervical region. Okay, so the for the muscle test just now, rate the muscle test from 0, there is no contraction. 1, grade 1 is a flicker contraction. Grade 2, full range of motion with eliminate gravity. Grade 3, full range of motion with no resistance against gravity. Grade 4, full range of motion, minimal resistance against gravity. And grade 5, full range of motion, maximum resistance against gravity. Okay, and then Sperling test. Sperling test. So the patient position is sitting in a relaxed facing forward position, and then patient is compressing from the top of the head, and then if patient is experiencing any numbing, and that is a positive sign. And then we do the ULTT test. The ULTT test is a nerve compression test as well, to see at which if there is any ULTT test is a peripheral nerve compression as part of neurodynamic test. Okay, so it has the main nerve test that should be tested is the first one is the median nerve, where the position is patient position is in supine with the shoulder at the edge of the table, and then patient at the side of the patient, therapist at the side of patient, and then the action is shoulder girdle depression, shoulder abduction, shoulder external rotation, forearm supination, and then wrist and finger extension, elbow extension, and cervical side flexion. That is for median nerve. For radial nerve, same position, but action is shoulder girdle depression, elbow extension, medial rotation of the whole arm, and wrist, finger, thumb, and flexion. And then last one is the ulnar nerve, where shoulder girdle are depressed, shoulder abduction, shoulder external rotation, wrist and finger extension, elbow flexion, and shoulder abduction. And then lastly, for the subjective and for the objective pain assessment is the dermatome assessment, using a pinprick and the hot and cold test at a dermatome. For the C2 is at the 1 to 2 cm lateral to the occipital, and the C3 is at the mid clavicular line, and then C4 over the acromioclavicular joint, C5 at the lateral aspect of the lower edge of the deltoid muscles, C6 at the palmar side of the thumb, C7 at the palmar side of middle finger, C8 at the palmar side of the little finger, and then T1 at the medial aspect of cubital fossa. Okay, and then so that is the upper limb dermatome, to see at which level the patient is experiencing nerve compression. That's all. Hello, good morning, Dr. Chua. So for station 2, question 2A, pain education. Demonstrate pain education. Alright. Good morning, Mrs. X. So today I am going to give you some information regarding your pain. Right? Did you know that your pain, that a pain is become chronic when it has a duration of 12 weeks or more. Okay. So this chronic neck pain often presents as widespread hyperalgesia on palpation in both passive and active movements of the neck and shoulder area. Okay, a few previous research has shown that psychosocial factors is an important prognostic indicator of prolonged disability in individuals with neck pain. Okay, and it is well known that this chronic neck pain is often associated with anatomical, psychological, social, and personal and professional factors. Okay, and then this is consistent with the biopsychosocial model, which considers pain as a dynamic interaction between biological, psychological, and social factors unique to each individual. Okay, so this neck pain is actually, it doesn't mean that your neck is damaged. Okay, the pain that that you are experiencing in your neck and shoulder and arms, okay, it doesn't mean it is damaged. It means that it is sensitized. Alright, your neck can be sensitized by like awkward movements and posture, muscle tension, inactivity, lack of sleep, stress, worry, and even low mood. It can affect the pain that you're experiencing in the neck. Okay, mostly neck pain is linked to minor sprains that can be very painful. So sleeping well, exercise, a healthy diet, and cutting down on your smoking if you're smoking, it can help in your neck as well. Okay, the brain acts as an amplifier, so the more you worry and think about the pain, the worse it gets. Okay, your neck is one of the strongest structure in the body. Okay, it is very rare to do permanent damage to the neck region. Okay, so you can do the normal activity and movement instead of avoiding the movement because of the pain. Okay, so the normal movement, regular movement of daily activities such as relaxed movement will help to settle the neck pain, and then the neck can even get stronger as you move, and then it's like a motion is lotion. Okay, so the more you move, the less pain you will feel. Okay, and protecting your neck will avoid movement that can make it worse. And then regarding the X-ray or MRI imaging results that you just got from the imaging department. Okay, this is to assure you that the scan changes are normal. Okay, like gray hair. The pain doesn't mean that you are doing any damage. Okay, your neck is sensitive, and that is all. So movement, again, I emphasize movement, will be maybe painful at the beginning of the movement because you haven't start the pain for a while. Okay, like an ankle sprain, but it will get better as you get more active. Okay, so let's work out on a plan to help your condition. In this case is your neck, shoulder, and arm. Okay, let's work out a plan and get you move. Okay, getting you back to work as normal as possible, or as much as you're able to do. Even start in a small step, even part-time at first, it can help you to recover. Okay, so that is for pain education. For question 2B is the pain intervention. Okay, so demonstrate the pain intervention. Alright, firstly, Mrs. X, what you can do to ease up your pain before you move, you need to have a lot of relaxation. Okay, do a lot of breathing. Okay, when you do breathing, breathe from the lower chest wall and stomach. Most probably put your hand just under your chest level, and then when you breathe in, make sure it's a diaphragmatic breathing. So breathe in, and then you are pushing your body outwards. Okay, and then you have to be aware of the muscle tension of the muscles of the trunk of the body. Okay, as you are relaxing. So breathe in, aware of the muscles moving, and breathe out. Okay, once you are relaxed, then you can proceed with the activities, exercise like mobility exercise. Okay, mobility exercise, and it is very good for you to do a flexibility exercise for the spines, and the neck, and also the shoulder movement. Okay, progress from non-weight bearing to weight bearing. For example, do a lot of neck and upper back stretches in sitting position, in standing position even. Okay, and you can progress it to with using a weight, okay, against resistance. And then when you are relaxed, do a lot of stretching, you can move on to more functional movement training, okay, with the relaxed movement. So the movements, avoidance of guided movement. Okay, and when you do activities, do not hold your breath, and then do not transfer the load on your hand. Okay, all right. You can transfer the movement activities into your daily activities, such as when you walk, when you are even sitting doing your work, you can stop for a while and do some stretching and movement, like twisting, like stretching the neck. Okay, and then you can even do the strengthening when after a while of sitting, you can stand up and find a corner of the wall and stretch your chest muscles, your pectoralis muscles. Okay, do it like this against the wall and push your body forward, so you are stretching it. Okay, and then other exercise as well, a lot of strengthening exercise. It can help to maintain your range of motion of the neck, and then okay, and stretching up as well. So the aim of doing this exercise for about 10 to 15 minutes every day, for 2 to 3 sets, it won't be excessively exacerbate your pain. Okay, but in fact, this exercise, even if it's in shorter duration initially, it is a very good indication that you want to get rid of the pain. So my point is, keep on moving, keep on exercising, instead of keep saying that there is pain, or else the pain will get worse. Thank you.